afternoon and welcome. You are watching Eagle News America. Thank you so much for joining us. I'm Ace Ramirez, coming to you from Washington, D.C. Tonight we have updates from several of our correspondents in North and South America. May Davila in Ciudad de Panama reports about Panama extending the people's access to personal hygiene items and medical supplies at affordable prices and in quantities needed in the fight against COVID-19. Nadine Dueñas in Ciudad de Mexico takes us to Mexico, where the nation celebrates its 210th anniversary of independence, with less festivities this year, but recognizing frontliners with the Miguel Hidalgo Award, the highest award given to its citizens. Thomas Likeness in Edmonton, Alberta.
The cost of living in Canada remains stable.
Milo Timbulan in Swarthmore, Pennsylvania.
Significant increase of COVID-19 cases in 19 to 24 years old across the state of Pennsylvania.
May Ann Manzano Guerzon in Sicklerville, New Jersey.
Updated quarantine advisory for individuals traveling to New Jersey, bringing new total to 30 states and territories.
Elmarie Gonzalez in South Haven, Mississippi reports about the hurricane warning continuing east of Mississippi-Alabama border to Okaloosa, Walton counties in Florida. Friend Delta Heron in Seattle reports about health agencies expressing concern over people's mental stability during the pandemic and provide ways how to cope. Rani Bayuga in Parisburg, Ohio.
Ohio governor signs bill protecting individuals, schools, healthcare providers, businesses, and other entities from lawsuits due to exposure, transmission, contraction of COVID-19.
Tristan Diaz in Bakersfield, California.
California theme parks call on state officials to provide health guidelines and safety requirements to reopen.
Plus David Reggio in Oxnard, California.
LA County moves to develop distribution plan for COVID-19 vaccine.
And Eli Austria in Pasadena, California. Eli reports LA County's Bobcat fire threatens historical Mount Wilson Observatory. But first, an overview of the COVID-19 situation. According to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time Wednesday, September 16th, the number of cases of COVID-19 reported worldwide is now more than 29,600,000. Top 3 countries with reported cases: U.S. has 6.6 million, 5 million from India, 4.4 million from Brazil. The virus has claimed more than 936,000 lives worldwide. Top 3 countries with reported COVID-19 related deaths: more than 196,000 from the U.S., 133,000 from Brazil, and more than 82,000 from India. Our coverage begins now. United Nations investigators said on Wednesday, Venezuela's president and top ministers are responsible for probable crimes against humanity, including extrajudicial killings and the systematic use of torture. In their first report, a team of investigators tasked with probing a slew of alleged violations in Venezuela said they have found evidence that state actors, including President Nicolas Maduro, were behind serious international crimes. Marta Valinas, the mission's chairperson, said in a statement, the international fact-finding mission created by the UN Human Rights Council a year ago found reasonable grounds to believe that Venezuelan authorities and security forces have, since 2014, planned and executed serious human rights violations. She said some of those violations, including arbitrary killings and the systematic use of torture, amount to crimes against humanity. She said far from being isolated acts, these crimes were coordinated and committed pursuant to state policies, with the knowledge of direct support of commanding officers and senior government officials. The 411-page report spelled out which Venezuelan officials it deemed responsible, citing reasonable grounds to believe that both the president and the ministers of People's Power for Interior Relations, Justice and Peace and for Defense ordered or contributed to the commission of the crimes documented in the report. The investigators demanded that Venezuelan authorities immediately carry out independent, impartial, and transparent investigations into the violations and ensure victims receive full redress. Now we head over to Panama. The Panamanian government extends people's access to personal hygiene items and medical supplies at affordable prices and in quantities needed to prevent and contain the spread of COVID-19. In Ciudad de Panama, May Davila reports.
Thank you, Ace. The Cabinet Council approves the extension of Cabinet Decree Number 7 that seeks to guarantee the population's access to personal hygiene items and medical supplies for the prevention and containment of COVID-19 at cheaper prices and in the quantities needed. The measure seeks to ensure the population's access to products such as chlorine, soap, alcohol gel, floor disinfectants, masks, face shields, gloves, gowns, and aprons for medical or surgical use, and oxygen. The Cabinet also authorizes the Minister of Agricultural Development, Augusto Valderrama, to present to the National Assembly the bill that creates the special regime for the establishment of operators and developers of agroparks. The purpose of the agroparks is to integrate and increase the participation of the agricultural sector, guaranteeing the transfer of technology and productivity to generate jobs throughout the country. The standard would develop a production model focused on market intelligence, national production, product orientation, promoting the country brand, and encouraging the establishment in Panama of companies with cutting-edge technology. Desde Ciudad de Panama, May Davila, Eagle News, vivimos en tiempos interesantes. Back to you, Ace.
Thank you, May. Mexico celebrates its 210th anniversary of independence with less festivities this year, but made sure to recognize the frontliners battling the pandemic with the nation's highest award for citizens, the Miguel Hidalgo Award. In Ciudad de Mexico, Eagle News correspondent Nadine Dueñas reports.
Today, September 16, Mexico is celebrating their 210th anniversary of their Día de la Independencia or Independence Day. However, due to the COVID-19, this year's celebrations were very different.
Gracias de nuestra historia.
Due to the COVID-19 pandemic, the Fiestas Patrias, or national festivities to celebrate the 210th anniversary of the independence of Mexico, were redesigned after more than 100 years of tradition to avoid contagions. Reina Ramirez Miguel of Ciudad de Mexico says this year's celebrations are extremely tamed down compared to past years.
Se está celebrando los 210 años de la independencia de México, o muy diferente, totalmente fuera de lo común o de lo normal. En años pasados íbamos al fuegos artificiales y todo eso, y esta vez pues lamentablemente no se pudo hacer nada de eso. Cada quien estuvo festejando en casa.
The government did not allow the citizens to attend to any of the official events to avoid the massive contagion. However, they were allowed to celebrate at their own houses and follow the events through the official channels and platforms of the government. And for this reason, there are very few people on the streets, unlike other years. Reina couldn't help but reminisce how this special day had been celebrated before.
No, realmente no se sintió, porque siempre hay muchos eventos en este día, no se trabaja, cosas así, y esta vez pues no, como un día normal.
The highlight of this year's celebration was the conferment of the Miguel Hidalgo Award, the highest award in Mexico, to 58 frontliners to recognize all their efforts in the fight against COVID-19.
En Ciudad de México, Nadine Dueñas, Eagle News. Vivimos en tiempos interesantes. Back to you, Ace.
Thank you, Nadine, and happy 210th anniversary of independence to Mexico. In other news, the cost of living in Canada remains stable amid the ongoing COVID-19 pandemic. In Edmonton, Bureau Chief Thomas Likeness tell us how that is even possible. Tom?
Well, good evening, Ace. You know, government bean counters at Statistic Canada tells us that the price for goods and services last month barely moved. As a matter of fact, prices rose by just 0.1% from a year earlier. So it really hasn't changed very much. Let's take a look at what happened. Gasoline prices remain low. Why is that? Well, demand worldwide is not there, and nobody's going to pay a big price for something people don't want. Airfares, they dropped. Deep discounts being offered by airlines, and this, of course, an attempt to fill up all those empty seats on jetliners. What else is down or unchanged? Prices for accommodations, telephone services, tuition fees also didn't increase. We did see some increases, though. Rents are up, and so is the cost of meals in restaurants. Oh, say, have you gone for a haircut lately? You probably noticed that stylists are charging more. That's, of course, to offset the cost of COVID-19 safety measures they've had to implement. And if you're thinking of buying that someone special some jewelry, well, prepare to dig a little deeper into the wallet. That's going to cost you more as a result of record high gold prices. Car and truck prices up as well, but not as much here as for our neighbors, you folks down south in the United States. And that's because Canadian dealers are offering huge rebates just to get people into the showroom and hopefully take a vehicle out for a test drive. Well, the low inflation rate means the Bank of Canada will keep interest rates low for the next few years. And, you know, that's good news for home buyers and people borrowing money, but it's a challenge for investors, particularly those pension funds that we're all going to be relying on someday well off into the future, or maybe in the near future. They're going to have trouble getting a good return. Oh, before I go, a quick weather update. It's been warming up here. You know, I've been complaining about the cold temperatures in the 50s for the last few days. Well, now we're actually made it up to a high of 19 degrees Celsius. That's 67 on the Fahrenheit scale, and we're expecting a bit more of an increase over the next few days. We should be in the low 20s. That's the low 70s for the next couple of days into the weekend here. We're far enough north here in Edmonton, so there's no smoke from those fires on the west coast. Actually, the only smoke I get is from my neighbor's barbecue. I think they're doing ribs tonight, but so far he hasn't invited me over. So wherever you are, remember to take care of yourselves, take care of others, stay home, stay safe, stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Ace.
Well, you're enjoying pretty nice weather over there, huh?
Well, yeah, for this neck of the woods, it is nice when you get up around, the 70s. Personally, I like it when it's more toward the 80s, but...
Oh, speaking of haircut, you mentioned something about haircut earlier. You look pretty sharp today. Is that a new haircut?
No, actually, I always feel underdressed when you're our anchor because you're always with a tie, so I put a tie on tonight. My wife, incidentally, is my hairstylist.
Anyway, well, talking about your approach, the Canadian approach, is that approach of keeping the prices low, if not as is, really helping the economy? Are the consumers enticed to come out and spend on their usual haircut or shop for a car knowing that the prices are not inflated?
Well, car sales, interestingly enough, are kind of holding their own, except for fleet sales. That's businesses buying cars. They're not buying, so all the fleet salesmen I know right now, they're starving. But the guys selling retail to people like you and I, they're actually making pretty good money. A lot of luxury items, musical instruments, for example. I was just reading about a guitar shop in Calgary that just did a booming business over the last few months. People are staying home. They've got time to strum a guitar, learn how to play an instrument. So things like that. Of course, he moved his business online. That's the big thing we notice here is people are buying a lot more online. even from established retailers that offer online offerings.
That's true. Amazon is making a killing. What else? Alibaba, I'm pretty sure. And
I'm talking about regular retailers, retailers such as Walmart. We have a big chain of stores up here called Canadian Tire. Best Buy. You can order all that stuff online and then just go down and pick it up. They offer a curbside service. So a lot of people have opted for that. When I've been in stores, which isn't very often, but when I've been in stores, there certainly aren't the crowds there. I had to pick up some office supplies a couple of weeks ago, and there was no crowd for the usual back to school.
It's just interesting, and I'm pretty pleased that still some of the businesses, if not most of them, are still thriving in this economy, in this condition.
Well, it's been challenging, and certainly they're watching costs. They're watching costs. That's all you can do. If you can manage your costs and keep the doors open, because it is more expensive to do business if you have a walk-in crowd. You've got the sanitizing aspect of things. A lot of stores have put up plexiglass dividers, and those don't come cheap when you're doing a chain of stores. So, again, it's cost.
That's right. Thank you so much for your report, Tom.
Thank you, Ace. You take care.
You too. When we come back, updates from our correspondents in Swarthmore, Pennsylvania, and Sicklerville, New Jersey. Eagle News America will return after this break. Stay with us.
Hello there, I'm Alfred, and I'm a graduate of Bachelor of Science in Computer Science, batch of 2008 in New Era University. I'm currently working as an operations analyst in Autodesk.
Hi, I'm Earl Espanio, and I graduated with Bachelor of Science major in Computer Science in 2010. I am a consultant at Trinity Consulting, LLC.
Hi, I'm Ivy Nakapagal, Bachelor's of Computer Science graduate, year 2010. I'm currently working as a cybersecurity analyst in one of the largest telcos here in New Zealand, Coast Park, NZ.
I'm Jofran David Riego, a BS Computer Science graduate here in 2015. As a legal analyst, I am tasked to read U.S. cases, specifically civil torts cases.
I am Melanie Rico Hermosa T, a Bachelor of Science in Computer Science graduate, year 2006.
I'm currently a software quality assurance engineer at FBI Systems here in Maryland, United States.
Hi, I'm Renzo Cruz. I'm a graduate of BS Computer Science, year 2012. I'm currently working abroad, and I'm working as a senior cybersecurity consultant who specializes in digital forensics and incident response. And I am part of a national security in one of the countries here in the Middle East.
I am inviting everyone to study at New Era University. To legit, too great.
Be brilliant in the new era.
Study now at New Era University.
Excellence,
Discipline,
service to humanity.
You're watching Eagle News America. I'm Ace Ramirez in Washington, D.C. Robert R. Redfield, the director of the U.S. Centers for Disease Control and Prevention, says COVID-19 vaccinations could begin sometime between November and December, but would be in very limited supply and administered to certain groups only. Redfield adds during a testimony before a Senate subcommittee that a vaccine for the general public will probably be available in the late second quarter or third quarter of 2021. Let's take a look.
Like said, I think there will be vaccine that initially be available sometime between November and December, but very limited supply and will have to be prioritized. If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021.
In the meantime, Redfield says masks are our best defense.
Under control. These actually, we have clear scientific evidence they work, and they are our best defense. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunity.
Redfield underscored the significance of the flu vaccine.
And as we move into the fall, we're adding one of the most significant scientific contributions to medicine to our evidence-based mitigation strategies, flu vaccination. Flu vaccine is safe, and CDC encourages Americans to embrace flu vaccine with confidence for themselves, their families, and their communities.
Redfield assures that politics will never get in the way of the agency's responsibility to provide the soundest and safest health advice.
Well, again, I'm going to commit, that we're going to continue to give Congress and the nation the best public health advice. We're not going to let political influence try to modulate that.
He also pointed out the increasing concern about the psychological effects the pandemic is bringing to Americans.
Cut back. CDC recently did a survey, and it actually shocked me. Just a survey across our nation found that 31% of adults reported now significant anxiety and depressive disorders. So this is a significant comorbidity that has been negatively influenced by the COVID response, and it is something.
There is an alarming and significant increase in COVID-19 cases seen in 19 to 24-year-olds across the state of Pennsylvania. And Swarthmore Bureau Chief Milo Simbulan has the story.
Thanks, Ace. Weather here in Swarthmore is about 66 degrees Fahrenheit or 18 degrees Celsius. And it's really a mild day today. The high is about mid-70s. Here's what's happening in Pennsylvania. The Pennsylvania Department of Health is seeing significant increases in the number of COVID-19 cases among younger age groups, particularly 19 to 24-year-olds. An alert was sent to healthcare providers about the changing COVID-19 case demographics, as there are more cases in younger age groups than in those 50 to 64 and 65 plus. The following regions saw significant increases among 19 to 24-year-olds in each month from April to date in September. North Central region approximately has 7% of cases in April, and it's now 69% of cases so far in September. Northeast region from 6% of cases in April to now 40% of cases this month. Southeast is nearly 5% of cases in April and now 33% right now. Southwest approximately 5% in April and is now 30% of cases in September. Northwest has nearly 7% of cases in April to nearly 20% of cases so far this month. And South Central approximately has 7% of cases in April to nearly 18% of cases so far in September. Why is there a big jump in cases? Here's Department of Health Secretary Dr. Rachel Levine to tell us more. Take a look.
The most significant difference between the case increases that we are seeing now and what we saw in April is that colleges and universities are back in session. College and university students are uniquely positioned now to help change the course of the spread of this virus by changing and adapting your actions to protect yourself, your friends, and others in the community. You are very welcome guests in the community where your school is based. But what happens on campus directly impacts everyone off campus and in the community.
Pennsylvania has more than 160 colleges and universities, and most of it, if not all, are now in session. And this increase we are witnessing right now will have impact to local schools and local businesses, and they will be at risk for closing again. Increase in COVID-19 cases will also have a huge impact to our brave and courageous frontline workers. That's why it's really important for everyone to follow the guidelines such as wearing masks, social distancing, and avoiding large groups. In Swarthmore, Pennsylvania, Myla Simbula and Eagle News, we live in interesting times. Back to you, Ace.
Myla, what is the protocol in Pennsylvania colleges and universities if there's a spike or worst case scenario, a community spread?
Ace, there's actually no guidelines right now, but one thing the Department of Health does not want to happen is for these colleges and universities to close, which will end up students going back to their hometowns and spreading the virus if they are infected. So there will be larger groups that will be infected. Ace?
Thank you so much, Myla. New Jersey updates its quarantine advisory for individuals traveling to the state, bringing the new total to 30 states and territories. In Sicklerville, May Ann Manzano-Guerzon reports.
Thank you, Ace. Governor Phil Murphy advised individuals traveling to New Jersey from states or territories with significant community spread of COVID-19 to quarantine for a 14-day period from the time of last contact within the identified state or territory. The updated advisory includes one additional territory, Puerto Rico, with California, Hawaii, Maryland, Minnesota, Nevada, and Ohio removed from the list, bringing the total to 30 states and territories. The travel advisory applies to any person arriving from a state or territory with a positive test rate higher than 10 per 100,000 residents, or a state with a 10% or higher positivity rate over a 7-day rolling average. As of Tuesday, September 14, there are currently 30 states and territories that meet the criteria stated above. Alabama, Alaska, Arkansas, Delaware, Florida, Georgia, Guam, Iowa, Idaho, Indiana, Illinois, Kansas, Kentucky, Louisiana, Missouri, Mississippi, Montana, North Carolina, North Dakota, Nebraska, Oklahoma, Puerto Rico, South Carolina, South Dakota, Tennessee, Texas, Utah, Virginia, Wisconsin, and West Virginia. Governor Murphy said it is the responsibility of New Jerseyans and visitors to our state to protect others from the spread of COVID-19. It remains critically important for anyone arriving to New Jersey from these 30 states and territories to get tested for COVID-19 and self-quarantine for 14 days. Travelers and those residents who are returning from impacted states should self-quarantine at their home, hotel, or other temporary lodging. Individuals should leave the place of self-quarantine only to seek medical care or treatment or to obtain food and other essential items. It is expected that the individuals will follow the public health advisory to self-quarantine. The list of states will be updated on a rolling basis. Meanwhile, here is today's statistical report of New Jersey's COVID-19 cases. According to the Department of Health of New Jersey, there are 447 new positive cases reported today, bringing a statewide total of 197,792 New Jerseyans tested positive. Sadly, we have 9 new deaths, pushing the total to 14,263 fatalities. New Jersey remains on stage 2 of its road to recovery. And Ace, for some weather update, it's currently 10:07 in the evening here in New Jersey, and it's mostly clear. Our temperature is 60 degrees Fahrenheit or 16 degrees Celsius. The high today was forecast as 73 degrees Fahrenheit or 23 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Grazon, Eagle News, we live in interesting times. Back to you, Ace.
Mayan, have you been out of state lately, or do you know anyone who traveled out of state?
Well, Ace, not me, but yes, I do know a couple. I have a couple of friends who went to Georgia for a wedding, and also a group of friends who went to Florida for a 2-week family vacation. But thankfully, Ace, both groups did self-quarantine for 14 days, and they were tested negative for COVID-19. Ace?
But this 14 days self-quarantine, is this mandatory or advisable?
It is more like an advisory, Ace. So we are just expecting that those who are traveling in out of New Jersey would, observe this 14-day quarantine, self-quarantine. Ace?
I see. Thank you so much.
Thank you, Ace.
Coming up, more updates from our correspondents in South Haven, Mississippi, Seattle, Washington, and Parisburg, Ohio. We will return shortly. Stay with us. This is Eagle News, America.
Ito po si Teresa Loizaga. Abangan po ninyo ako sa Himig ng Lahi ngayong linggo, alas 8 ng gabi, dito po sa Net 25.
Welcome back. You're watching Eagle News America. I'm Ace Ramirez in Washington, D.C. We reported earlier CDC's concern about the increasing number of adults reported with significant anxiety and depressive disorder related to the pandemic. And Seattle Bureau Chief Frendel Teheran shares with us ways to cope with this disease creeping into homes across the nation. Frendel?
Thank you, Ace. The coronavirus disease pandemic, the effects of natural disasters may be stressful for people. Fear and anxiety about uncertainties and worries could be overwhelming, and the CDC says that it can trigger strong emotions in both adults and children. Public health measures like social distancing could cause one to feel lonely and isolated, which could increase stress and anxiety. However, guidelines such as these measures are necessary to minimize the spread of COVID-19. Having the ability to manage and cope with stress in a healthy way is advantageous to us all. It can make you, the people we care about, and our communities stronger. Now, the CDC shares information, a lot of great information about stress and how we can cope with this, because stress during an infectious disease outbreak can sometimes cause the following, and I just want to get into a few of those, which is fear and worry about your own health and the health of your loved ones, your financial situation or job, a loss of support services you rely on, changes in sleep or eating patterns, difficulties sleeping or concentrating, worsening of chronic health problems, worsening of mental health conditions, increased use of tobacco and or alcohol and other substances. Now, everyone reacts differently to stressful situations. And again, I'm referencing the CDC, and how we respond to this stress during the COVID-19 pandemic can depend on our background. For example, our social support from family and friends, financial situation, health and emotional background, the community we live in, and many other factors. They are advising us to take care of ourselves and our community. Now, taking care of our friends and our family can be a stress reliever, actually, but we need to make sure that we keep it balanced and not forget about ourselves. Now, what happens when we allow stress to take over and cloud our mental well-being? Now, so one of those things is actually substance abuse, as we heard previously. According to American Public Health Association, calls to the Substance Abuse and Mental Health Services Crisis Hotline increased 891% in March. Now, what are the other impacts of mental illness? Suicide, which is often associated with symptoms of mental illness, is the 10th leading cause of death in the US. And sadly, it's the second leading cause of death among people aged 15 to 34. Now, as you can see, stress can really lead to mental instability. So we just need to know how we can cope with this kind of stress. Now, these are some ways. Know where and how to get treatment. Take care of your emotional health. Take breaks from watching, reading, or listening to news stories. Take care of your body, make time to unwind, connect with others, connect with your community or faith-based organizations. Now, taking care of your mental health is an important part of our overall health and well-being. It affects how we think, how we feel, and how we act. It may also affect how we handle stress, relate to others, and make choices during an emergency, which is extremely relevant and timely because we just don't know when disaster will strike us. So we need to make sure that we are stable mentally and very strong. Now, Washington Department of Health provides the resources that could help and support our mental health and well-being. Now, for access to these resources, Washingtonians, I want you to grab a pen and paper. We can call 833-681-0211. Now, switching gears, earlier today, I had a heart-to-heart discussion with a healthcare provider. Not only is she a healthcare provider, she's a loving mother as well, who had gone through depression, anxiety, stirred up from an unhealthy relationship, to the point she thought of harming herself. Thankfully, she identified her need for help and acted upon it. Allow me to read a quote from our discussion. "I'm so glad I reached out. My counselor played a big part in my recovery. Having someone to listen to me without judgment and with sincere empathy is key to mental healing. We need to talk and open up to people who are in place to guide us. If we keep things bottled up, it could lead us to harming ourselves." She wanted to keep herself anonymous, so she went with her initials LMW. Again, she is one of a very hardworking healthcare provider. Now, we definitely need to take care of our mental state. And I sound redundant because it's just so significant that we know this, right? And it could start with taking steps to help alleviate and minimize stress. Let's watch this short video for some tips.
Hello everyone, it's your girlfriend Alpha Heron. What do you think of when you're told to stay healthy? The majority will think of getting physically healthy. What we oftentimes forget is about our mental health. Stress management has powerful benefits. Per healthcare professionals, one of the benefits is that it boosts our immune system. At this day and age, a healthy mind and a strong immune system is what we need to overcome life's troubles. WebMD's 10 tips to managing stress. Number 1, exercise. Number 2, relax your muscles. Number 3, deep breathing. Number 4, eat well. 5, slow down. 6, take a break. 7, make time for hobbies. 8, talk about your problems. If things are bothering you, talking about them will help lower your stress. You can talk to family members, friends, and even you can talk to yourself. But make sure that when you do talk to yourself, it's all positive talk. Number 9, go easy on yourself. Number 10, eliminate your triggers. Figure out what are the biggest causes of stress in your life. Is it your job, your commute, your schoolwork? If you're able to identify what they are, see if you're able to eliminate them from life or at least reduce them. Stay tuned to EBC's Digital Nest as we connect, learn, share, because together we grow. Friends Alpha Heron, we live in interesting times.
All right, so the tips again, it was actually pretty much what I had emphasized earlier today. We have to just make sure that we have time for self-care and self-compassion. So essentially do what you love. You have to make time for what you do, what you love to do. As far as reading a book, taking a nice walk outside when it's good air quality, spending time with family. Do what you can to alleviate and minimize your stress. Now, should we experience increased stress and overwhelming sense of fear and anxiety, Let's use the resources that are available to us to help us cope. And you can find all of these resources through the CDC. You can go to your respective state government website, and they have it all there for you. It's out there, so make sure that we use those. Seattle, Washington, Friends Alpha Heron, Eagle News. We live in interesting times. Back to you, Ace.
Thanks, Frendel. In Ohio, Governor Mike DeWine signs a bill into law protecting individuals, schools, healthcare providers, businesses, and other entities from coronavirus lawsuits, which include exposure, transmission, or contraction of COVID-19. In Parisburg, Eagle News correspondent Randy Bayuga reports.
Thank you, Ace. Bill 606 was signed to law today by Governor Mike DeWine. Sponsored originally by Representative Diane Grendel, provides immunity to individuals, schools, healthcare providers, businesses, and other entities from lawsuits due to exposure, transmission, or contraction of COVID-19, or any mutation of the virus. It does not cover intentional or willful misconduct or recklessness. Many associations, colleges, medical, and various business groups support the bill. Andrew Dohel, president and CEO of the Ohio Chamber of Commerce, was quoted, "Ohio businesses stepped up when asked to help with this pandemic crisis. And we are pleased that the Senate and House, along with the governor, have acted to help protect jobs and our economy." The bill also protects the healthcare providers from liability where they may have caused harm or injury in the care of patients during the pandemic, unless they can be proven to have been reckless or intentional. COVID updates. There are now currently 139,485 confirmed cases of COVID-19 as of yesterday. And deaths, the number of deaths have increased sharply to 4,506. Hospitalizations currently at 14,481. ICU admissions at 3,111. The number of counties in Ohio that are in level 3 public emergency, very high exposure and spread of the virus, are now down to 6. And including also the level 2 public emergency counties are also going down as Ohioans continue to practice social distancing and wearing masks. Travel advisory. Those traveling into Ohio from the following states must or are recommended to self-quarantine for 14 days. The states include South Dakota at 16.9 positivity rate and Idaho at 16.4 positivity rate, Alabama at 16.2, Mississippi at 15.8, Texas, which was not able to provide an updated status, is still also added in the advisory. Weather report for Perrysburg, Ohio. Currently, it is 57 degrees and partly cloudy with a 40% chance of rain. We are expecting some showers this evening. And for Thursday, it will be partly cloudy at 68 degrees with a low of 47 with a 20% chance of rain. Fall weather is here in Perrysburg, Ohio. From Perrysburg, Ohio, Ronnie Bayuga, Eagle News. We live in interesting times. Back to you, Ace.
Thanks for the report, Randy. Reports from Bakersfield, Oxnard, and Pasadena, California. That's next. We will return shortly. Stay with us. This is Eagle News, America.
The New Era University, in its 45th year of excellence, discipline, and service to humanity, will offer online education all levels beginning this first semester academic year 2020 to 2021 through the NEU Virtual Learning Environment, or NEU VLE. New Era University offers a complete basic education cycle from kindergarten up to senior high school, offering all strands. NEU has 18 colleges, and 2 graduate schools. It also offers ALS and ETF. Best of all, NEU has the most affordable tuition fees among private universities in the Philippines. NEU is at Quezon City, the city of San Fernando, Pampanga, General Santos City, South Cotabato, Lipa City, Batangas, and Pinugay, Baras, Rizal. New Era University is under the stewardship of Dr. Nilo L. Rosas. What are you waiting for? Be part of the new normal. Enroll now. Classes start on October 5, 2020.
I think I'm going out of my head.
Efra Montes po. Mga bro, ayusin nyo naman ang tono at kanta nyo dyan.
Agulolala po. Ma'am sir, swabe boses ko, di ba? Baka siya. Ako. Hello, Mans. Joel Trinidad po. Okay, ito.
Eh di ako na. Lord Mendoza po. Ang malayelong boses sa lahat. O Ege! Ege ka! Bahala ka sa buhay mo! Ege!
Makigulo! Makitawa!
At makipagkantahan kasama natin ang ating mga OFW dito lang sa
Saya Saya!
The search for the best continues. Tagisan ng Galing Part 2 is now accepting audition entries. Kung ikaw ay 21 to 59 years old at may angking galing sa pagkanta, mapa-solo, duet, trio o banda man, magpadala na ng audition entry. Narito ang mga guidelines. Para makapagpasa ng entry sa singing category, contact Nikki sa 0977-651-9504. Ito na ang pagkakataon mo para maging tagisan ng galing grand winner at manalo ng 2 million pesos. Para sa karagdagang impormasyon, i-like ang Tagisan ng Galing Facebook page. Kaya sali na!
This is Eagle News America. I'm Ace Ramirez in Washington, D.C. Eager to once again welcome patrons and generate revenue, California theme parks reach out to state officials for health guidelines and safety requirements to reopen. In Bakersfield, we have Eagle News correspondent Tristan Diaz with the details.
Thank you, Ace. The California Attractions and Parks Association, or CAPA for short, is an organization that represents the amusement and theme park industry in the state. Universal Studios Hollywood, Disneyland, and Six Flags Magic Mountain are among approximately 30 amusement parks that have closed their doors and attractions to the public due to COVID-19. There is now a push for safe reopening of these various theme parks, largely due to the unprecedented financial problems caused by the temporary closures and tens of thousands of jobs at risk. CAPA Executive Director Erin Guerrero said, California's amusement parks urged the governor to issue amusement park guidelines expeditiously so these vital community attractions can reopen their doors. and even cautioned the loss of hundreds of millions of tax revenue, with local businesses having to shut down all operations. Disneyland is one of the amusement parks represented by CAPA. To many people, it's the happiest place on earth, annually attracting millions of tourists to their parks and neighboring businesses. Located in Anaheim, California, it currently ranks as the second most visited theme park in the world, after Disney World in Florida in the #1 position of most visited. Disneyland was set to reopen 2 months ago in mid-July, but forced to cancel their reopening plans as they were unable to obtain approval from local officials. Meanwhile, Disney World in Florida was able to reopen effectively with modifications in place for COVID-19 safety measures. CAPA Executive Director Guerrero further stated, as evidenced by the many open amusement parks in the United States and around the world, visiting an attraction will not look the same as before COVID. But California's amusement parks are ready to responsibly reopen. And a small weather update here. Right now in Bakersfield is at 84 degrees. We had a high today of 91 degrees and a low of 62 degrees. In Bakersfield, California, Tristan Diaz, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, Tristan. See you in Disneyland.
Thank you.
Looking forward to the much anticipated COVID-19 vaccine. Like more than 3,000 counties in the nation, Los Angeles County prepares by developing a distribution plan for when it is available. In Oxnard, David Reggio reports.
Thank you, Ace. The Los Angeles County Board of Supervisors unanimously approves a formal proposal by District 4 Supervisor Janice Hahn for Los Angeles County departments to work together on how county officials will coordinate and manage the distribution and administration of the COVID-19 vaccine upon availability. In her motion, Supervisor Hahn opened with the statement, quote, "The COVID-19 pandemic has devastated the health and well-being of Los Angeles County. The long-standing hope of an effective treatment or vaccine has been our motivation to continue living with social distancing, masks, and other measures as our normal." End quote. The motion directs Los Angeles County Department of Public Health to collaborate with departments in the county, local cities, and community agencies for the development of this vaccination plan, with an update report due to the Board of Supervisors in 45 days. The Center for Disease Control and Prevention, or CDC for short, have notified and furnished guidance to state public health officials that they may begin their vaccination plans on how to distribute, so once available, they will be ready for the COVID-19 vaccine. The CDC guidance covered the requirements for the preparation and distribution, from data reporting, ordering, storage, and handling of the vaccine vials to determining the high-risk priority groups in need of the vaccine, from the healthcare professionals to the elderly residents in long-term facilities, and establishment of mass vaccination clinics for the general public upon the arrival of more vaccine doses. Supervisor Hahn said, quote, "We are the largest county in the nation, and when the time comes, we will need to fairly and equitably get a vaccine to over 10 million people. We need to start preparing now to receive, store, distribute, and administer a vaccine so we don't waste any time." End quote. There are presently 37 vaccines in clinical trials, with 3 vaccines in phase 3 of trials. There are reports that a limited number of COVID-19 vaccines in the 3rd phase may be ready as early as November this year, with the rest of the vaccine dose supplies available next year. With our weather updates, recently it has been clear over here in the Oxnard area, with temperatures of a high of 75 degrees and a low of 58 degrees, although it is expected to be partly cloudy in the next few days. In Oxnard, California, David Reggio, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, David. The historical Mount Wilson Observatory is under threat of the Bobcat fire that has burned more than 44,000 acres with limited containment. In Pasadena, Eli Austria reports.
Thank you, Ace. Los Angeles County's Bobcat fire threatens the historical Mount Wilson Observatory. The Bobcat fire continues to rage unabated over a week now since erupting on September 6. The already uphill battle with this blaze has taken a turn for the worse as fire crews were forced to give ground. According to sources from the Angeles National Forest, the previous 6% containment estimate has been downgraded to now only 3%. And in a statement from Los Angeles County Fire Captain David Dantic, the fire has now burned over 3,000 acres. Among the structures threatened by the fire is the historical Mount Wilson Observatory. In a tweet, the U.S. Forest Service has said that the flames were within 500 feet from the observatory, but fire officials officially reported that crews were in position, quote, ready to receive the fire. The Mount Wilson Observatory has been a fixture in the San Gabriel Mountains since 1904 when it was founded by George Ellery Hale with funding from the Carnegie Institution. Rising over 5,000 feet above sea level, the observatory is famous for housing the 100-inch telescope. Major scientific and astronomical breakthroughs were made at this observatory, such as when Edwin Hubble, one of Mount Wilson's early astronomers and after whom the Hubble telescope was named, began identifying galaxies in the 1920s. Each year, the observatory welcomes troops of visitors free of charge for standard touring, but has had to close its doors to the public because of the coronavirus pandemic. But now, with the Bobcat fire ravaging the area, the entire Angeles National Forest is closed, forcing stargazers to wait and hope that Mount Wilson's celebrated observatory will be spared the devastation of oncoming fires. Currently, over 1,100 personnel have been deployed to battle this wildfire, with more resources desperately needed. But due to the multiple wildfires rampaging throughout the state, additional help will be hard to come by. And so, as the fire continues to spread, the order to evacuate has been issued to some residents, while others remain anxiously on standby. As for the weather here in Pasadena today, we had a high of 97 degrees Fahrenheit and a low of 69 degrees. In addition, the air quality in the area continues to be affected by the smoke resulting from the wildfires. In Pasadena, California, Eli Austria, Eagle News, we live in interesting times. Back to you, Ace.
Thank you, Eli. We continue to thank our healthcare workers, first responders, and essential workers. A special shout out to our firefighters battling the West Coast wildfires. We do appreciate your dedication. And as always, we give you all a round of applause. We appreciate you. This is Eagle News America. Thank you for joining us. I'm Ace Ramirez. We live in interesting times.